And this is the chat page, how it looks. And it's very similar to what you see when you use MSN. And young adults are very used to that. And when I explain the program to the patients, they understand very easily, because I only have to teach them for like 15 minutes or 20 minutes, and then they are well familiar with the program. So they write at the bottom of that page, and then they click enter, and then the message shows up at the top. And also the messages from the coaches you can find at the top of the box. And this indicates the name of the coach, and if the spot is green, then the coach has logged on. And there is a rule that it's always the coach that starts the conversation. And this is our official homepage, and unfortunately you can only find that in Swedish by now. And it's called the NP Young Coaching. And here you can find interviews with coaches and participants, how they perceived this model. And there are also interviews from the newspapers who have been interested in the project. You can also read about how the chat program is working. So this is a homepage that you can recommend, for instance, if there is a participant who's curious to be part of the project, and, for instance, new units who would like to use the program. We have not really terminated the pilot study in Gothenburg yet, but still I've got some preliminary data. And we are both doing quantitative analysis and qualitative analysis on the chat. And in the pilot project, there were 12 individuals included, and we had 2 dropouts. It hasn't been that easy to recruit, actually, but we had decided that we should start with 12. And the median age of this group is 17 years, and the range is 15 to 26. And in the beginning, I said it should be between 15 and 25, but then it was a bit difficult to recruit, so we allowed one who was 26 as well. And they are 5 females and 7 males. And 6 of them has an autism spectrum condition with or without ADHD, and 6 of them have ADHD only. And the 2 dropouts were the 2 with ADHD, not any with autism spectrum condition. And when it came to self-esteem, we had a significant increase of self-esteem after the support. And there was also a significant decrease of depressive symptoms according to the hospital anxiety and depression scale. And we could see a tendency towards a higher quality of life after the support. But I mean, it's a small group, so it's difficult to reach statistical significance. We also had this interview after the 8-week period of support and coaching, how the patients perceived the support. And we asked, for instance, did the coach understand what were the main problems that you needed help and support with? And 9 out of 10 answered correct or correct to a large extent. Another question was it good to meet the coach twice during the 8-week period? And also 9 out of 10 answered correct or correct to a large extent. So we believe it's very important that you actually have this face-to-face meeting as well. One further question was, did the support and coaching correspond to your expectations? And 6 out of 10 answered correct or correct to a large extent. And finally, how important was it for you to get this support? And 9 out of 10 said of great importance. And now some preliminary results from the quality data. And these are from the chat log, what they have been actually written on the chat. And what are the patients writing about? Well, they want help to get in bed in time because they stay up all night, and you're probably very familiar with this problem in young adults. And they want help for planning for adult life. They also have problems with understanding and handling friends and family. And some have written about identity problems. For instance, one patient who had problems with her sexual identity. How to get things done. Conflicts, especially with parents and friends. How to manage schoolwork, and how to manage homework. That's a big problem, and sometimes the patients are not really aware of what they want to work with at the internet-based support and coaching. And then we suggest, do you have any problems at school, for instance, with homework and so on? And they say, well, I would like some support with that. How to handle stress, another issue, and also how to plan. And what have the coaches written about at the chat log? Well, thanks. They try to elucidate the neuropsychiatric diagnosis and the disabilities. And they try to teach structure and strategies and how to and they have to handle the patient's frustrations for different things. And they encourage and confirm. Continuation, what happens next? Well, we will try this intervention at other units as well. It has already started at a neuropsychiatric treatment unit in Borås, and that's 60 kilometers from Gothenburg, and they only see adults, but we want them to use it on adults between 18 and 25 to be as similar to our own group. And they have patients with ADHD and also with Autism Spectrum Condition. We've also been contacted by habilitation units for adults. And at these units, they don't see ADHD, but they have patients with Autism Spectrum Conditions. We've also been approached by a private company working with supporting people with both Asperger's syndrome and ADHD, both at school and at work. So to conclude, I would say that we think that the patients benefit from this kind of support over the internet. And finally, a bit early, but these are the collaborators, both at our own clinic and at the clinic in Borås, 60 kilometers from us. And at the bottom of this page are the addresses for the chat program and also for our official homepage. Thank you very much.